In the KARMA trial, patients with relapsed refractory multiple myeloma received ide-cel, and this led to an improvement in efficacy and overall response rate in these patients. However, this was at the expense of increased toxicity, and one of these toxicity were cytopenia. So we evaluated in our real-world cohort a single-center study where we included 52 patients who received ide-cel for relapsed refractory multiple myeloma, and we assessed the cytopenia rate at 6 months after ide-cel infusion. We also analyzed the effect of cytokines on the occurrence of cytopenias at 6 months after ide-cel therapy. 52 patients were included. At baseline, 27% of these patients had baseline cytopenia. All in all, rates of any grade cytopenia was 71% at 6 months. However, most of these cytopenias were of grade 1 or 2, so only 17% of these patients had grade 3 cytopenias. When we looked at the rates of growth factor requirements, 27% of these patients required any transfusions or growth factor administration. One patient required stem cell boost to boost their counts, and they recovered. One patient, unfortunately, developed myeloid sarcoma at the same time of myeloma relapse. When we looked at the cytokines at baseline and different time points daily until patient discharge, we find that pro-inflammatory cytokines like IL-2, IL-15 were associated with cytopenia at 6 months after CAR-T or ide-cel. However, angiopoietin 1 was associated with hematopoietic recovery. So we are now expanding this cohort, and we need a better understanding how these cytokines at baseline can predict cytopenias at 6 months after ide-cel.